I'd like to thank everyone for joining us this morning to hear about the Community Partnership Fund. As most of you know, Providence is committed to achieving our vision of health for a better world by partnering with our communities in addressing health disparities. In 2019, the Montana service area provided over $31 million in community health investments. Today, you'll hear more about how the Community Partnership Fund will be expanding into Montana to continue the tradition of meeting the needs of our communities that we serve. I'd like to introduce Gabriela Robles, the Executive Director of the Community Partnership Fund. Gabby?
Thank you so much, Mary, and thank you. Good morning, Montana. Good morning. And thank you, Mary, and you and your team for co-hosting today's open house and also for the great work that you partner with in your community. And good morning, everyone. This is a very exciting day for us. We were planning to be there in person. We were planning a road show. We were planning some yummy snacks, but this is the way we will connect and introduce ourselves today, and really looking forward to meeting all of you in person in the near future. And so for today, we want to introduce the St. Joseph Community Partnership Fund, and we call it the Fund. And we'll share a little bit with you about what has been the work, what is the philosophy of the fund, how we've engaged with the community over the last 34 years. And then we'll share with you our expansion, how our footprint is expanding beyond California and Texas. And most importantly, we will be talking and having conversations with all of you about how we can partner together. And really, as the theme of today's open house, how we will be moving forward together. So thank you for that. And as part of a tradition of Providence St. Joseph Health, we will start off with a reflection from Sister Suzanne Sasses that will provide a bit more of the history of the fund, and then we'll get going. So thank you so much.
At the heart of Catholic healthcare is the healing ministry of Jesus, taking care of the neighbor without distinction, taking care of the poor. St. Joseph Health has been doing care for the poor and community benefits since its inception and before its inception. But we didn't do it because of government regulations. We're doing it because it's the heart, it's the purpose for which we're in healthcare. St. Joseph Foundation, as it was originally called when it was founded in 1986, was founded at the request of the sisters who had said to our first CEO, how are we going to continue taking care of the poor? We're in this ministry. It is a ministry as well as a business. And the purpose of the ministry is to continue the healing ministry of Jesus. And if you go to the scriptures, you see that Jesus took care of everyone. He took care of them body, mind, and spirit. And that has caused us to do the best we can and to evolve as we saw the needs evolving. When we formed our health system, our fear was that our new leaders, who we irreverently then called the suits, because they were mostly men, might not understand how important all that was for us. So we said to our first CEO, how will you assure us that we can continue to take care of the economically poor? The Community Partnership Fund has been a way of expressing, of continuing our legacy of caring. I see the Partnership Fund as being the vehicle that's going to take our legacy of caring for the dear neighbor into the future. I've especially been proud of the systemic change that we've been able to bring about by developing communities, by empowering community leaders. That has brought whole neighborhoods and whole areas to a different level of well-being so that we can keep people well and keep them out of the hospitals. Everything in healthcare is changing. And if we are to continue what we call Catholic healthcare, there has got to go through all that change, the constant of the mission. I hope we all at St. Joseph Health and now Providence St. Joseph carry on this legacy of caring, which is also the legacy of the Sisters of Providence, by continuing to find structures, policies, and programs that will give stability to this aspect of our mission that can move into the future. The hope I hold and the vision I hold is that in the midst of the constant changing and evolution of healthcare, we will remain faithful to caring for the dear neighbor who is close or who is stranger, body, mind, and spirit, continuing to extend the healing ministry of Jesus.
So this provided you a little bit of history about the vision of the work of the fund. The fund is an independent 501c3 grant-making foundation, founded in 1986. So next year we'll be celebrating our 35th anniversary. And the focus has always been in serving our dear neighbor, serving the economically poor and vulnerable. And for us, it's a very exciting time. Now that we're joining with Providence as Providence St. Joseph Health, we have the opportunity to serve more communities and to honor the legacies of the Sisters of St. Joseph of Orange and the Sisters of Providence. Next, please. And this is our mission statement. And what really calls us to this work is not only providing and the assistance, but most importantly is to partner and utilize the strengths and the diversity of our neighbors to build vibrant communities. Money can't do it alone. And from the very beginning of this work, we've recognized the importance of partnerships, both from the community, from decision makers, from policymakers, to really address systemic change and really create together, co-create healthy communities. Next, please. And this is the leadership team of the fund today. I'm the executive officer of the fund. Jason Laksamana is the senior program officer. Lisa Barrios is the grants manager. We also have Teresa Beard with us and Carrie Schoenwald, who's also supporting the work of the fund at this time. Next, please. And then we just want to share a little bit internally. Within the organization of Providence St. Joseph Health, the fund sits within the Community Partnerships Division. Mary's team also sits here under Community Health Investment, along with government affairs, philanthropy, education, and global and domestic engagement. This gives us the opportunity to collaborate together in the works that we do to further the mission of the organization and to further our support of the communities that we serve. And I will now introduce Jason Laksamana, our Senior Program Officer. Oh, a little bit more. Expansion. Okay. So as I shared with you, we started in California and Texas. And so now our footprint is expanding to 7 regions, 7 states, from Alaska to Washington, Oregon, Montana, New Mexico, and Texas and California. And even within California, we are now in the Los Angeles County. We used to be primarily in Orange County and High Desert in Southern California. So this footprint gives us the opportunity to learn from each other, to bring other funders, leverage those relationships, and to really do more together. Next, please. And for Montana, these are the hospitals and the medical centers in the state of Montana that serve you and your communities, and that we look forward to visiting in the near future. Next, please. I just now want to introduce Jason Laksamana, who will share with you a bit more about what we do and our strategic framework. Jason?
Hi, good morning, everyone. Thank you again for making some time I'm sure out of everyone's busy schedules today to walk together with us and learn a little bit about the fund, and also allow us the opportunity to learn about you. Like Gabby said, we had hoped to be there in person prior, obviously, to our current pandemic situation. We made every effort to be in communities where we have a presence. You'd always find us on a plane or on a train or on in a car getting out there, even though we are based in California. Through the wonders of technology, we're trying to do it virtually. I know it's no substitute for in person, but we will be there as soon as we can. But we work in partnership with our partner hospitals. I know Mary is on the call and was able to introduce us and have that relationship throughout the Providence St. Joseph system. What we do, we are strategic grant makers. We are not a fundraising foundation. We instead work with communities to make investments strategically into communities through grants, through other partnerships. We work with a strategy that is not only about supporting services, but also about broadening our impact, looking at different innovations, looking at how we can broaden the scope of the work. We'll get into that in the presentation, but taking on some risk as we're very risk tolerant as a partner to go in and elevate community work and community innovations, and supporting communities with what you're already doing or what you want to do. We have an informal motto, meeting the community where they're at. This means understanding that there are different needs and different also opportunities and different potentials and different capacities and different cultures that exist in each of the communities. There's not a one-size-fits-all approach for us as a fund or as a grant-making foundation, but really working closely with community for to match up opportunities and capacities. I do want to call out a little bit from our mission that all we do is focus on improving the quality of life for the most vulnerable and marginalized in our community. And the name that
Jason, I'm sorry, I think we've lost your sound. We can't hear you, Jason.
Okay, I'll continue. Okay, thank you. Okay, so we can go to the next slide now, please. So one way that we thought would be an opportunity for us to connect with you via technology was to ask you a couple of questions that Paul will bring up just to get a sense of who's in the room, and we'll share that information. So think of this as a little commercial. So Paul, if you can provide the survey for us.
Certainly. So we're now going to launch a poll. You may need to, it may come up automatically on your screen. You may need to go to your bottom bar and click on polls for you to see it. This is just a series of questions, as Gabby said, to help us understand better about who is in this call. So there are 4 questions on here. How familiar are you with the fund? What does your organization primarily focus on? Who do you primarily serve? And then what counties you operate in. There's a limit of 10 choices, so that's why there's some others in there, but you should again be, the poll should be popping up for you, and we'll take a couple minutes for you to answer this. Great, and I see the answers coming in, so thank you. Some of you on phones may have difficulty viewing this. If you're not able to answer the poll, don't worry. There will be breakout groups, and then we'll be capturing some additional information in there.
Hello, folks. This is Jason. I'm back. Sorry, we had a little bit of technical difficulties, but as it happens, that's what happens sometimes. And I appreciate your patience. And I think you'll find that we are a less formal foundation. So it comes with the territory. And everyone who is a member of our foundation has had significant community experience working in the community, either as a practitioner or in the nonprofit field ourselves. So we would like to bring that lens in working with you. So and I don't want to detract too much from the poll here, but again, thank you. Again, the wonders of technology, but also the limitations of technology. And so we're just going to roll with it. A little piece here, what I was finishing my thought before getting cut off, that our name is very meaningful for us. It's a community partnership fund. And so really emphasizing both the community aspect, being with community, serving and aligning. But also to do that, we need partnerships, which are authentic, and fund. But it's not just money, it's not just grant, but it's resources. It's operationalizing all of our resources in support of those communities and partnerships.
And it looks like we have most people answering, so we'll leave it open for about another 10, 15 seconds if you are finishing up answering the poll questions, and then we will share the results with everybody. All right, I'm going to end the poll. And again, if you didn't get a chance to vote, don't worry, there are other opportunities. And now everybody should be able to view the poll results.
This is great. And I think this is akin to what we were expecting. Obviously, we have been a foundation that's been primarily active in California and Texas over the 30 plus years of our history. We're entering a new phase with Providence St. Joseph Health as we expand, as Gabby mentioned in the previous slides, to areas where Providence Health and Services has had a history and relationship. So I think it's great that some folks are already familiar with us, but obviously we're new. We're new to Montana. We're new perhaps to your work. It's great to see the spectrum of focus areas of issues of need that folks on the call are working on. I think as we will discuss in the Zoom call later, we take a similar approach. We cast the net wide. We have a pretty broad definition of what health means, and it incorporates a lot of this. This is the 4th virtual open house that we're having across the system, and the spread here is similar to what we're seeing in those places, obviously, especially housing and homelessness and basic needs coming up. And also the spread of folks who you are serving. And it's again in line with where we're going. And then it's also really good for us to see where people are coming from. And we see that there is a pretty great diversity of folks in terms of geographies, in terms of counties and locales from where you're from. And this poll is not just a poll that we're just going to put away and I think that was a fun exercise, but really build off of it. That this is, I realize, a first touch point for many of us on the call, learning about the fund and learning about your work. We want to learn from your work. We want to see where the needs are. We want to see where you're working, which communities you're working in, and then build off of your work, support your work where there's alignment. There'll be many other touch points, and there'll be opportunities for folks, if interested, to schedule one-on-ones, or perhaps we learn more about your work and we'll reach out to you to learn more. We really believe in partnership, and we really believe in relationships, and that's what this work is about. And hopefully today is the first step in that relationship building. So I want to continue a little bit on the kind of work that we do and our strategic framework. And you'll see here. And some of these words and phrases have been, especially in the last few years, really elevated, not just in Providence St. Joseph Health, but across the different fields. But these are our pillars. We have a focus on the upstream, on social determinants of health. On the next slide, we'll talk about that. We have a focus on equity, not just having an equity lens in our work, but also focus on achieving equity as a goal. And it's not just health equity, but that's a big part of it. That we are intentionally collaborative, that we need to work together if we're going to get to solutions. We are responsive to community needs, but also responsive to the opportunities. And that we need to be innovative. That innovation, we need new solutions. We need better solutions. And obviously building upon the learnings of the past and the learnings of things that work now, but how can we continue to push? Because the solutions to those issues, the issues in the community are complex. But these are our pillars. They guide our strategy. They inform our strategy, especially upstream, collaborative, community, innovation, all of that leading to equity. Equity is a fundamental driving value for our foundation. Our strategy is focused on addressing, improving, and redesigning community-level systems towards equity and justice. Yes to services, but much more than a clinical or a medical approach. For the next slide, this is a bit of what we mean by social determinants of health. I think folks here are accustomed to this. I'll just share a little bit of the working definition that we have, that social determinants of health are the conditions in which people are born, grow, live, work, and age. I also like to add play and pray. These are circumstances that are shaped by distribution of resources, of money, power at different levels, global, national, and more pressing at the local level. These are factors like housing and nutrition and economic opportunities. Immigration is one that is now recognized as a determinant of health. For us, and for many, this isn't new. It's really more about how do we address the root causes. And I think when you look at our grant making over the last 30 plus years, traditionally we have worked with and supported organizations that are providing needed services and in many cases emergency services to meet needs in the community. And this is of critical importance, but we also recognize the need to keep pushing to do more. It's what we call a yes and approach. Yes to meeting the critical needs of today, but also investing in strategies that impact root causes, that address community systems, that take not just a long, hard look at system inequities, but also uplifting and trying out solutions that have that system level impact. This is what we are attempting to operationalize in terms of an upstream strategy. The next slide on equity, again, I think equity is a term actually over the last couple months that I think has been much more, I guess, used much more, obviously in response to social needs across our country and across the world. We believe and have always believed that health disparities or health inequities are real and that our grant making must address equity. And achieving health equity, yes, and health equity meaning equal opportunity for all populations to prevent disease and have healthy outcomes. That includes access to health care, regardless of various characteristics of race, of gender, nationality, sexual orientation, religion, immigration status, socioeconomic status, really with a focus on the most vulnerable, those who are from low-income communities. But we also know that it's beyond health equity. We're also talking about just equity in general, equity and justice, and within that, racial equity and justice. And that means supporting strategies that operationalize our investments towards equity. What does that mean? Looking at our partnerships through an equity lens, looking at who's involved, how are we addressing not just a service need, but also an underlying community need, and what are the histories that are rooted in what results in what we see today. This working towards achieving equity is about serving the common good, and that's done by creating systems and opportunities for all that lead to equity for all. I'll turn it back to Gabby to talk a little bit about our collaboration again.
Great, thank you so much. So collaboration is also part of our strategic framework, but I really see it more as a value that we have hardwired in how we engage in the community. You know, we've asked, and I'm sure a lot of you've been asked by funders to collaborate. And we all know that takes a lot of work and effort. And so we take this very seriously. And it's not just an activity. And so what we're able to do as a funder within the third largest health system is leverage those relationships and really bring other grant makers, other grantees, other systems, other organizations, other for-profits to the table to be part of the conversation and how to address an issue of concern. Below, you'll see a number of our partners. We couldn't include all of them, but just wanted you to know that our commitment to collaboration is part of how we engage as part of our work. And then the next slide, we really want to highlight the importance, as Jason said, of meeting the community where they're at. It's really not our intent to research or come up with these amazing models that academia is promoting and expect the community to be able to kind of run with those ideas. There's a lot of value in the research of both in academia and in the field, but we know that primarily it's the community that really are experiencing some of the challenges, but also have ideas and solutions and really know what it will take to get something done. And so Jason later will be highlighting some of our initiatives that have really been developed as a result of these listening sessions, sitting at the table with the community, multiple languages, you know, bringing many religions to the table to really seek to understand, okay, if there is a challenge in the community with gang violence, how do we address that? You know, where do we start? And it's the mothers of these young adults, it's, you know, the schools, it's those who know the community best and can really teach us how best to move forward. And because of this engagement that we've always seen as part of our strategy, it's helped us evolve both as a team. It has taught our board the realities of the community, and ultimately it's informed how we invest in this work. The next slide, please. You know, and lastly, innovation. And we're very fortunate to have a board that has been very supportive of us being innovative. And the way we see innovation is taking risk. You know, anything that we do, we acknowledge there's some risk, but we've actually taken on some informed risk in some of these models that we support, or maybe in some of the communities, because we see the potential. And part of this helps us learn together and really think about how we can do things better in the future, and how best to bring our board along in this work. Because all of you know, the work that you all do is not simple. It's, you know, in the clinical world, we've got data, great data. Sometimes it's seen as black and white, right? Very controlled. In the community, it's very different. And so we seek, and we see our responsibility to also inform the internal leadership about this work. And a lot of it has to do with the support that we have both from our Providence St. Joseph leadership and our board to innovate and take on some risk in this work. Okay, next slide, please. Now, Jason will share with you a bit more about our focus areas. These are new focus areas for the fund based on conversations with other funders, with grantees, with internal leadership, and also looking at our 3-year community health needs assessments at all the regions that we support and understanding what are those priorities in those communities. Thank you. Jason?
So yeah, I think you can see here, capacity building, housing, education, disaster response, and recovery and resilience. As I mentioned, we have this yes and approach that we are doing what we can and working in partnership with our local hospitals and local partners to meet immediate needs. But we also are looking at systems approaches. We're also looking at deeper impacts on certain areas. And over the last 5 to 10 years of our foundation, we've been much more intentional about incorporating this lens and this approach and this strategy into our work. And you look at these and you may be asking, but aren't you a health foundation? I don't see health here. It's you know, I see housing, I see education, I see disaster. In our strategy, we recognize the intersectionality of these issues. There's an interplay between these issues. They have impacts on each other, and they have impacts on health. And I think it is taking a look at how we operationalize the social determinants of health strategy, that these are social determinants that down the line or side by side impact health. Now, for instance, housing insecurity. Depending on the type of housing you have, the security of housing, the quality, the affordability, there are linkages to either better or worse health outcomes. I think that the data bears that out. There's a link between education and health, and not just those who have higher attainment levels of education have better access to health, but also within the educational system, within the educational field, there's certain health implications, traumas for some folks, for some youth, restorative justice practices in schools that may or may not exist, criminalization of youth that may occur that will have not only effects on their long-term well-being, but also immediate effects on behavioral health, on mental health, and how that informs and impacts them throughout their lifespan. And disasters. And traditionally, the fund has worked as a disaster responder, that we've gone into places not just in our service areas, but across the world to provide resources for response. But disasters lay disparities bare. They lay inequities bare, such that those folks and those communities that were struggling before are often the hardest hit in a disaster. And in recognition of that, acknowledging that, trying to develop a strategy here where we're not only responding, but we're building preparedness, we're building capacity, we're building resilience in those particularly affected communities, so that can prevent and mitigate future disasters. And disaster is one where we have kind of a broader scale of definition. It's not just about natural disasters like floods and wildfires in California or the West Coast, earthquakes, but also other disasters, man-made disasters. And right now, also looking at the pandemic as a disaster itself, COVID-19 as a disaster. It's just much more widespread and affecting many folks, both physically, health-wise, and in our culture and our society. So going in and trying to have this broader view of disaster in all of these focus areas. Our next slide is really where we've focused our work up to this point. And these are initiatives that have been primarily active in California over our 30+ year history. But I'm just sharing with them them with you as examples of the different ways that we support community, looking at different domains, both across the individual, community level, and sector-wide. And when you look at our initiatives, I'm just trying to give you a flavor for the opportunities that are to come and that we want to work with you on. That we have had initiatives that have focused on emergency needs. We have one that's called the Emergency Food and Shelter Initiative, which it's in the name that we know that there's emergency housing that's needed. We know that in various areas there's shelters, homeless shelters, domestic violence shelters, youth and women's shelters, food assistance, food pantries, food banks, care coordination. We have supported that in the past. Moving up the ladder, I guess you could say, of our focus, we also look at community. We have a community building initiative, which focuses on a neighborhood level strategy, where we work with community residents, building leadership, but also providing a structure for those residents to identify what are the most pressing community needs, including health needs that are affecting them, and devising a strategy with community residents to not just meet that immediate service need, but also looking at longer range impacts that can be embodied through local policies, maybe at the school board or city council level. And then our Intersections Initiative, which in California was is a $4 million 3-year multi-sectoral collaboration that looks at articulating what an upstream strategy looks like for communities. How do we address housing in a community? And housing that may, on one level, seek to serve the homeless population and address those needs, but also look at issues like housing security. How does certain policies in play in certain areas impact housing to prevent folks from falling into homelessness in the first place? Or things around education, or things around, at least in some parts of the state of California, around immigration. What does that look like? And what are the connections to health? And what are the connections to broader policies that community groups working together in a collaborative can impact? I touched a little bit about our disaster relief. We have also a sustainability initiative, which has been focused on providing supports to build capacity and infrastructure and sustainability across nonprofits. We know that nonprofits are often tasked to do more with less. How do we provide that support so that there can be a better functioning, better operating? And when opportunities come up, investing in innovative practices. Again, I think we look at the foundation as one where we can take on the risk so that there is sharing in the future across the field. In the next slide, I do want to share a little bit about our COVID-19 response. Back in March and April, the health system, Providence St. Joseph Health, focused some early funding out into all of the regions where Providence St. Joseph Health had a region, had a presence. This was rapid deployment of funding and was offered to the region, working closely with our hospital partners. This had a focus on those most in need, those who were most affected or potentially could be most affected, with a focus on prevention of spread of COVID-19. I think since then, we've been working with various funding partners across the grant-making sector, listening to the nonprofit sector also about the emerging needs. And we've taken the time to build that into a phase 2 of this strategy. And realizing and acknowledging that COVID-19, unfortunately, is here. And we are not going to go back. And we're not, unfortunately, although I think as much as we want to wish, we're not going to get back to where we were in February. But I also think, I don't think we should want to go back to exactly where we were in February, because we were already dealing with inequity. We were dealing with disparities with marginalized communities back then. Instead, this next phase of work is an acknowledgement of the human and economic impact of COVID-19 and the need to foster and support collaborative community strategies for the long haul. That it's not only about getting through the pandemic, but also building structures and supporting efforts that hit those overarching issues and factors. Again, building off of this yes and approach that you've heard me talk about, and looking at meeting capacity needs and having the ability to focus on root causes. So just recently, we put out an opportunity, I think our first major initiative as this new foundation in these new areas, the Community Recovery and Resilience Initiative. I think we've had a good response so far across the communities. The letter of introduction phase of that closed last Friday, and I know that there are several folks, perhaps on this call, that submitted a letter of introduction, which is the first step in our grant initiative process. But I will say, and maybe this is more relevant for the folks that were not, did not apply, or in the future maybe will not be selected for that initiative. It's a first step again in this relationship building. The needs are still there, and I think we are one resource, but and an initiative like that is one opportunity, but it's still one opportunity. There's going to be other opportunities to come. So the long view of us looking at education, of housing, of disaster, that is work that we're committed to over the next several years. Looking at the needed partnerships to have in play, looking at what that structure is, not just in our Community Recovery and Resilience initiative, but those are going to be structures that we have in all of our initiatives, this community focus, this collaborative focus, this upstream focus, and balancing it with the immediate needs. On the next slide, this is a little bit more about us, not just as a grant maker, but also as how we operate beyond funding, beyond providing resources and directly money. We engage in research and sharing best practices to inform the field, supporting convenings and publications that elevate work, sharing data, sharing reports, but providing new frameworks that are accessible for grant makers, for nonprofit sector partners, for government, and really field building. This is part of what it means to work upstream too, because we really believe this is about building the evidence base. And I think, I think we have some grant writers and some nonprofit executives that they get often hit by, well, we need, by a funder, we need evidence to support your work. We want to only support evidence-based strategies. We realize a lot of the community work is innovative, it's community-informed work, and sometimes it's not rooted in evidence. It's rooted on community hunches or what we know in the community as what works. But our effort here is to help elevate that and share it across the field so that it becomes recognized as evidence-based, as informed by research, so that it can be built upon, not just in the locale where it was developed, but built upon and shared across various sectors and geographies, locally and nationally. I'm going to move a bit now to some questions. And, in previous open houses, we've had quite a bit, but I think this is a much more intimate number of folks here where I'm happy to engage. Please feel free to utilize the chat function if you have a question. We can record that, we can get to it. If we run out of time on today's Zoom call, we can follow up with you. Or if there's comments or you want to share your work. Again, we wanted this to be an interactive session. We had hoped to be there in person, but we're going to use the technology as best we can. I know we had a poll at the beginning, but following this section, we're going to break out into groups so we could actually get into some discussion with each other. There's some questions that have come up directly to me. Can we set up some one-on-one time? Yes, definitely. Please reach out. You can either put your desire to set up a one-on-one in the chat, or you can email us. There's towards the end of the presentation, there's going to be our contact information. Our contact information is also on our website if you want to reach us that way. There's a question about the kind of grant making we do. We support 501c3 organizations. We also support collaboratives and partnerships. The only requirement, though, with a partnership is that the receiving organization has to be a 501c3 nonprofit organization. You could have a government entity as part of that partnership. You could have a for-profit business. You could have a school, a church, but the receiving entity has to be a 501c3. How do you do your grant making? Is it through RFPs, requests for proposals? Is it an open invite? It really depends on the initiative. Sometimes we have open calls for submissions, but sometimes we have more focused direct invitations. And I think we as a Community Partnership Fund staff want to take on much more of the pre-work and not put too much on the nonprofits themselves to write a 30-page application, for instance. We don't want folks spending their time there, but really looking at what conversations can we have ahead of time that lead to this. So there'll be time for more questions. We can talk a little bit about that in the breakouts. I know we have some questions in the breakouts, and we can follow up with direct questions directly also after the Zoom here. But as I said, we do have these breakouts, and I want to bring back Paul, our partner, to walk you through the breakouts and what that will look like.
Hello, everybody again. So in a minute or so, you are going to get automatically moved into a breakout group. Some of you may have had Zoom breakout groups. They work quite well. You don't have to do a different Zoom or anything. You just automatically go into that room. You'll be in that room for about 20 minutes. And then you will receive a 1-minute warning via a chat, and then you'll get a message that says it's time to come back to the room. You have 30 seconds to move back to the room, or you're automatically moved back to the room, and then we'll reconvene. Each session will have a facilitator as well as a member of the fund staff there. And the facilitator is going to walk you through 3 questions. The first one is not on the screen, and that is we're just going to ask you to introduce yourself, the name of the organization, and if it's not obvious from the name of the organization, who you serve, what you do. We're going to ask you to do that in the chat in the interest of time, and that will all be captured. So that will be in the chat. The next 2 questions we are going to ask you to talk about verbally. The first one here is, what collaboratives are you involved in or do you know about in your area? And to be clear, we're not asking you to talk about how your organization collaborates with other organizations, because we only have 20 minutes and we know you're all collaborating in so many ways. Instead, we're talking about formal collaborative efforts that you belong to. So multiple organizations coming together with some formal communication procedure, vision, and the like. So really, as Jason and Gabby have both mentioned, that is something the fund is very focused on, and we want to learn more about what you're doing. So that again is a verbal question. And then the where we're going to spend more time is on this last one, the dream big, or if you know the idea of BHAGs, big, hairy, audacious goals. So if you had a magic wand, what would you do? What major change would you make in your community to have the most impact? It doesn't necessarily have to be realistic. It doesn't have to be something that can be done in the next 3 months. It's probably not something that can be done in 3 months. We want to hear from you about, if you could dream big, what would you do? So again, those are the 3 questions. I know that most of you have turned your video off for the main room. We are going to ask you to turn your video back on so you can see everybody, and that will help the interaction a little bit more in the group. So again, I'm going to hit the magic button, which moves you all to your room. We will be in the rooms for 20 minutes. So you have until 11:45, which is 10:45 for West Coasters. And then again, you'll get a 1-minute text warning, and then everyone will move back. So enjoy the breakout groups, and we'll see you all back here in 20 minutes. Hi, folks. I'll get you in a breakout group just in a second. So, all right, Kate, you should. There we go. Good. Kate, are you still here? Or... All right, I think we are all back. So now we will have a brief report out from each of our 3 facilitators, and we'll go in order of the rooms. So that is Haley, then Marilyn, then Carrie.
Okay, thanks, Paul. Thank you, everyone. I know we had a couple of technical difficulties in our room, but we had some great conversation. So thank you so much. Thanks for sharing everything on collaboratives in your area and the BHAGs. So the BHAGs, we started out talking about racial equity and the importance of ramping up education in communities about how race is, how it impacts health and how it is intertwined with health, and the desire to activate people to do something and form a community and a team and get people's attention to work on these issues. And I mean, Judith, who shared a lot, had a lot of details that I would love to share, but in the interest of time, I'm just going to say it was a lot about the need to decrease poverty, arrests, and work on policy issues and get things done. And she closed with saying that we have momentum right now that we can take advantage of. And I think everybody kind of agreed. In terms of, there's another BHAG, which is kind of related to food security, especially for children and families. The schools are a good place to get food, and folks are not able to access food in those centers at this time, and so not in the same level. So it was said that like COVID has definitely exacerbated the need for the issue of food insecurity, and we need a BHAG would be to come around that and resolve it. Another is regarding the creation of a child visitation center and safe exchange center for mothers and parents going through divorce and foster care, specifically in Lake County. There's a need for that, and also a need for a chemical dependency facility. So, you know, those individuals facing those challenges need resources. And another really interesting conversation that came up was the topic generally of a lot of smart people, a lot of great organizations in the communities that lack capacity to collaborate. This is not uncommon, but it sounds like for, you know, in general, it's not uncommon to lack capacity to collaborate, time and resources, but it does sound like, you know, this community is really hungry for more time, more funding, more opportunities to intentionally collaborate. And I hope I've captured that pretty accurately. And thank you so much for sharing, everyone.
Okay. So we had a couple of major themes in our BHAGs in breakout group number 2. The first of which was related to affordable housing. So one, there's a need for more affordable housing, and then also working on the disparity between an individual or family's income and then being able to meet their, you know, rent needs, and trying to figure out how to help those who might have to choose between, you know, paying for a medication or paying rent or for utilities and things like that. We also talked about, along those lines, the housing choice voucher wait list, needing to potentially, or hoping that that could be, I'm sorry, there's a plane flying over me right now, but figuring out how we could better or more quickly clear that wait list. And then also we talked a little bit about making accessible homes for seniors and for the aging population. Also, there were some thoughts about increased need for, you know, better case management support around mental health and substance abuse. And then another one was being able to expand services that are provided for children that are in school. So after school programs and expanding those, especially now that there might be a shortened school day for those students that their parents work. And then lastly, we talked a little bit about creating more widespread awareness for resources and the need for funding for those who are suffering and their families, those who are suffering from Alzheimer's and dementia. So a lot of different ideas today, but they were all good ones, and I really appreciated the group that I had. Everyone kind of fed off of each other and bounced ideas off of each other. So it was a really good conversation. So thank you guys.
Great. Yeah, I had a very verbal group. I picked on everyone, but they seemed very willing to be picked on, and everybody shared some dreams. We ran the gamut. Several people did talk about housing issues, creating more affordable housing. We talked about creating tiny house communities for free housing, and especially for Native populations and single moms. There were several people who brought up chemical dependency issues, creating programming that is much more focused on drug and alcohol treatment that's more widely available in different formats, and really has a model where they really meet people where they are at. And currently that doesn't seem to exist, and it's very difficult. Again, as far as housing policy changes that are needed sort of at the state level, right of first refusal for residents of homes being sold, and low-income housing tax credits, a minimum wage that doesn't put a minimum wage that is livable, like $15 an hour, but doesn't put so much burden on employers so that it's actually possible. Free healthcare for all, and again, significant public housing or free housing available. And how do we just effectively engage our own communities in ending homelessness, and really looking at root causes and addressing those, especially now with COVID having greatly increased the homelessness population. And let's see, I feel like and as far as suicide prevention, really bringing in all of the sort of nonprofit spaces and perhaps other cross collaborators to really look at causes of suicide and sort of suicide prevention and navigating suicide, and helping communities post-suicide or families, especially doing more research and reporting in particularly vulnerable communities such as Native communities. And then last but definitely not least, really campaigning and engaging people around taking public transportation, but creating, improving public transportation so that it really is available to all and sustainable and accessible. And I think that pretty much covers it. Thanks everyone for dreaming with us. It's a great group.
Again, thank you. As Carrie just said, thank you everybody for your active participation, and thank you to our facilitators and reporters. We're going to hand it back to Jason to do the next steps.
Yes, thank you everyone. And you know, I was in a group, and it was great to hear all of the work being done. And there was a natural riffing off of each other. And I think it speaks already to the level of partnership and coordination that exists in Montana amongst many of you already. I know there's folks that are in different places. So part of the opportunity was to really connect, not just for the fund, but also for those who may be learning themselves of the different partners there. So we're happy to help facilitate that also across issues, across sectors, across geographies. But I again want to thank you for this last session, the breakout session, because I think you're getting a little bit of a taste of how we want to do our work as a foundation. We don't want to do it alone. But in order for us to do work first, we need to dream together and work together on finding where those opportunities are, but where our shared dreams, what they look like, and then design that together, strategize together. I think you have within us a foundation that's willing to learn, but we're also willing to bring lessons that have worked in other places and see how it could be adapted or utilized or not utilized in your area. I think we have a lot of work to do, and we hope to be seen as just another partner. I think we used the word another friend in your community, a new friend. I think Jesse had a really great question. Said, well, what does this mean? We have pre-existing relationships with Providence and the Providence Foundation, and certainly with Mary. Does this mean that we go to you now? And the answer is no. Keep going to who you're working with. Keep working with the different foundation partners, the different Providence leadership and Providence Health staff. Look at us as another resource that is entering. But we don't want to step on toes. We don't want to come in thinking that we know everything, because we don't. There's a lot we don't know. But we're coming in just with a willingness to learn and a willingness to, I guess, as the theme of our presentation today, to move forward together. So, you know, with that, it's really looking at what does the rest of the year look like for us. You had heard a little bit about our Community Recovery and Resilience Initiative. I know several organizations applied for that, and we'll be selecting those initiative recipients in the next couple months, actually in the next 3 months. I know there are folks that did not apply. I want to reassure you that that's not the only initiative that we're going to engage in. It's kind of like a starter initiative to get our feet wet, I guess you could say, in the different geographies. But hopefully, as you heard, there's many different areas. We don't have a magic wand. I think there was a part of our conversation in a breakout that you wave a magic wand and we can do this. And, you know, one of the wishes was like a magic wand and everyone gets a grant. I don't think we're that big of a foundation to do that, but I think, you know, it is working together. It's finding those opportunities that have alignment with our strategy and focuses on promising strategies in the community. And at the very least, you'll have our pledge to work together on that. We continue to learn, and we'll continue to learn about your work and listen to feedback that you have for us. There may be things that we could be doing better, or efforts that we should be involved in from the start. Please let us know. It's continual learning for us. this open house, the initiative, those are just early touch points. We have a 34-year history in California and Texas. We hope to have a longer history in Montana, and we're just at the start of that. And, you know, in the 6 months, it's beyond Montana. It's the other states, all the way from Alaska, Washington, Oregon, California, Texas, and we'll be continuing to support the work there. I like to also think that even though we're in different regions and different geographies, we're all dealing with similar issues. And so part of our work will be bringing folks from different regions together. So maybe there might be a promising strategy in Montana that we can share with folks who are active in Northern California and leverage the efforts there. Not only to share learnings, but to look at this as a larger movement building opportunity, whether it be on housing or equity or justice. So much more to come. I do appreciate everyone's sticking with us through some technical difficulties. I told Gabriella early on, I hope they don't think we're like a stuffy foundation coming in, but really see us that, you know, we're not stuffy. And so hopefully you see that. Again, we have all on our staff have nonprofit experience, but just the willingness to want to work together. Some of it is going to be some honest conversations about what comes next, about investments we can and cannot make, but that comes with an authentic relationship. On this slide, you'll see our contact information. We've already had a few people express, hey, can we have a follow-up meeting? Can we talk more? And please email us, and we'll set that up. We'll set those up over the next few weeks and months and into the future. And you know, learn a little bit more about us on our website, but please reach out. You know, I think that's it. I think we had hoped to be there with coffee and juice and cookies and berries. And at the first available time where we can be up there with you, we'll do that. I'd love to have coffee and cookies with y'all. I'll bring it. I'll bring them. So thank you so much for your time. Thank you for the staff and our colleagues. But I wish you well. And I look forward to connecting with you soon. So everyone, thank you so much and enjoy the rest of your week.
Thank you.
Thank you.